Going to switch gears now, and we've talked in this meeting frequently about the need to merge science and advocacy to move this forward, the whole field forward, and get across the finish line. And it really is our pleasure to be able to introduce Congresswoman Suzan DelBene from the 1st Congressional District in the state of Washington. She is a wonderful advocate for innovation in dialysis, and she is the co-chair of the Congressional Kidney Caucus. So she really has been a tremendous advocate for, in the U.S. Congress, for example, for Kidney X, etc. And we have Suzan DelBene giving us her views on a congressional perspective on the state of dialysis innovation.
Hi, I'm Susan. Thanks to the University of Washington Center for Dialysis Innovation for inviting me to speak at this 5th annual Ideas Conference. As a proud Husky, I want to thank all of you for your efforts to help change the lives of so many patients with kidney disease. First, I want to update you on some of the significant breakthroughs we've recently seen in Congress. Last week, I helped pass the Inflation Reduction Act. This historic legislation will lower prescription drug costs for Americans on Medicare by enabling Medicare to negotiate drug prices, limiting out-of-pocket insulin costs to $35 a month, capping out-of-pocket drug expenses at $2,000 annually, and limiting drug price increases to the rate of inflation. The bill also ensures that millions of Americans can maintain affordable health coverage by extending the ACA health insurance premium subsidies for another 3 years. The bill will also invest in future generations by cutting greenhouse gas emissions by roughly 40% by 2030 through investments in our climate and energy security and reducing the deficit by hundreds of billions of dollars. This legislation took more than a year to negotiate between the House, Senate, and the White House. Also last week, the President signed into law the CHIPS and Science Act, which will make critical investments in American competitiveness, research, and innovation for years to come. The bill invests $52 billion in grants and $24 billion in tax incentives based on legislation that I introduced to encourage companies to build semiconductor chip plants in the United States. These miniature devices are vital to many of our state's top industries, including medical devices like ultrasound equipment, defibrillators, and other technologies that are critical for patient care. Now let's talk about kidney disease and the work we must continue to do in the coming years. I'm co-chair of the Congressional Kidney Caucus, which is currently made up of 60 bipartisan members. Through the Kidney Caucus, we're working to educate our colleagues in Congress as well as the public about kidney disease and the federal government's role in providing access to life-sustaining treatment for those suffering from this condition. As many of you already know, when a patient advances to end-stage renal disease, they automatically qualify for Medicare, so the role and the responsibility of the federal government to promote kidney health is quite significant. Unfortunately, it's been more than 50 years since there was any major advancement in dialysis. That major advancement, the invention of dialysis itself, started right here at the University of Washington. But the treatment of end-stage renal disease has largely gone unchanged since then. I believe that if we invest in our physicians and scientists who are committed to the idea that we can do better, we will soon see the next breakthrough that will improve outcomes for this vulnerable population. We must also address the current care model. It isn't sustainable financially and results in painfully poor outcomes for patients. Hemodialysis costs an average of $90,000 per patient annually in the United States. In 2019, Medicare spent $153 billion to treat patients with chronic kidney disease. That's roughly 1/4 of all Medicare fee-for-service spending. Compare that to the $45 billion we allocated last year for the National Institutes of Health. If we cured kidney disease, we could fund the NIH threefold and still have billions in savings. That's why efforts like Kidney X are so important. Kidney X, short for Kidney Innovation Accelerator, is a public-private partnership between the federal government and the American Society of Nephrology to accelerate innovation in the prevention, diagnosis, and treatment of kidney diseases through a series of prize competitions. I was excited that UW's Center for Dialysis Innovation won a $650,000 award by KidneyX, its third award from the program, for its efforts to develop an artificial kidney. This research has the potential to provide patients more flexibility in their lives by freeing them from time-consuming and painful hemodialysis treatments. People suffering kidney failure in the U.S. and across the globe should have access to a wider variety of life-saving treatment choices. I've been very encouraged by the efforts here at the University of Washington, led by Drs. Himmelfarb, Ratner, and their team of experts. I look forward to the continued advancement of safe artificial organ technologies like implantable, wearable, and portable kidneys. The Kidney Caucus is already pushing for a future in which kidney care includes treatment choices for patients that include artificial organs. Patients who are awaiting an organ transplant or prefer not to depend on traditional dialysis technologies should have options that help them stay healthy and fully capable of pursuing whatever they want to pursue in life. This year, my Republican counterpart from the Kidney Caucus, Dr. Larry Bouchon, and I got 54 of our colleagues to join us in sending a letter to the Appropriations Committee urging a $25 million federal match for KidneyX. That said, the draft of the House funding bill maintains $5 million for KidneyX for the next fiscal year. So we have our work cut out for us. I hope you will all join me in keeping up the pressure because innovation in this sector is sorely needed. We also need to push hard on the administration so that President Biden increases his funding request for KidneyX next year. I'm hopeful that KidneyX will be the spark that spurs meaningful innovation in the kidney space, delivering better care for patients and allowing for the continued sustainability of Medicare. In addition to KidneyX, we now have a new Medicare payment model coming online soon that will improve care delivery. Based on a 2020 law, this model will ensure that kidney transplant recipients have continued access to immunosuppressive drugs on Medicare if they don't have other health insurance. Enrollment begins on October 1st, and coverage will start on January 1st, 2023. As this law is implemented, we need to make sure we're educating physicians and pharmacists about the new benefits so we can reach as many patients as possible. I encourage anyone here to please reach out if you have any input on how this new benefit is being rolled out. Thank you again for inviting me to speak, and I look forward to seeing our progress continue.
Let's give a hand to Congresswoman DelBene, who really is a wonderful advocate for our entire community.